little short on time, so do we have any questions online? And any, oh, we got one right here. All right, so I think just time for 2 questions.
I'm sorry, Rajam. Sorry.
Oh, no, you're fine.
I'm sorry.
Mike, can we get it up here second? Well, then the people online can't hear you. Mike, no, actually, it was Karen up here.
Oh, sorry.
And hi, Karen, I haven't seen you yet.
Thank you so much for your talk. It's really in line with what I enjoy about the relationship between outcomes and trying to motivate people and the therapeutic alliances. You know, my brain just couldn't stop with the question about, do you have a self-assessment in that model that you publish? Because, I mean, after clinical training, it's very hard to create, you know, another opportunity to do self-reflection intentionally. So is there a self-assessment tool?
There's no self-assessment tool.
Next!
However, here's the deal. You're a very smart girl. What I think, what's missing from this framework is that reflective piece. And in my data, I'm going back to it. I started analyzing it, but I had to dump it. So no, there's no self-assessment tool, but I'm not a big tool person. So I am also working in tangent with a mentor of mine, and we're writing a paper on reflective practice and strategies for reflective practice. And so I've actually kind of just developed kind of I think it's a 5 or 6 step process of actually taking reflecting, but then taking it into action. All right, to structure it a little bit more.
Okay.
But very good.
Half a question? I'm so sorry. I know. And it's actually about cutoff. So the idea that you become kind of connected in this therapeutic alliance, in this relationship, and you are trying to highlight resourcefulness to allow them to move on past you. But this connection sometimes is challenging to...
And here's the deal. Okay, so this is a margarita talk, right? This is, you know what I mean? Like this is like a taco talk, right? You know, by the fire. But yes, and I don't necessarily believe that you sever connections with people. Okay, I'm gonna put it out there. Everybody get nervous and twitchy, and then go have a margarita.
All right. Did we have any online questions for this speaker? No. Okay. One more in the room, Jody. Or Jason, was your hand up, or you just point? Okay. How's I skipped you last time?
Ask a question anyway.
Thank you very much. This was really helpful as far as therapeutic relationships. I'm a massage therapist, and I work in a couple different venues. One is a luxury spa, and what I notice is disclosure becomes a very slippery slope as people ask a lot of questions because they want to be trusting and comfortable, yet management is like, don't go there. Do you have a... I know
are you trying to corner me into
yes,
dealing with your manager or something?
It's very difficult because I like to talk and I want to make people feel comfortable.
Well, I don't know what to tell you. For me, to me, you need to be congruent and negotiating what you're. I think we all negotiate this though. I mean, we negotiate like our colleges, right, and what they tell us we should or shouldn't be saying to people, right, or talking about, right. So, I think I don't know. I don't know what to say. I think you know what. Do what you feel is honoring you, but also just really be, because I was a talker too, right. So really mind the boundaries and then reflect it back to them to get them talking. Is that good? Okay.
Awesome. All right, thank you.
Hey, thanks.